All right, folks, so welcome to this conversation. We are going to be able to have the opportunity to listen to Chris McCutcheon, who will give us the presentation on the Framework Adaptation Roadmap towards a social determinants of health framework for the Yukon. So if we can give him a warm welcome as he joins us here on the podium. We do have short time periods, so we'll let him get started right away, and that should give us enough time for a few Q&A before we move to our next presenter in half an hour.
Hi, everyone. I'm Chris. Thanks for staying and for this presentation. I know it's the end of the day. Everyone's probably looking forward to getting home soon, but I'm hoping this will capture your interest. I'm from Ottawa originally. I've been in Whitehorse for about 2 years. I feel very privileged to do so. I know that's the traditional territory of the Tonquitchin Council and the Kwalindun First Nation. But I still have a foot in Ottawa. I'm a manager of a research network called the Integrated Knowledge Translation Research Network. We're about 160 researchers and knowledge users who specialize in collaborative research, co-produced research. And I'm still based at the Ottawa Hospital Research Institute. So I should acknowledge as well that that's traditional territory of the Algonquin people. I want to talk to you about a project that I'll be doing for my PhD, which is at the University of Ottawa in Population Health. And I'm calling this the Framework Adaptation Roadmap. So I'll talk you through it and look forward to hearing your questions. So the starting point for this project is the Putting People First report. I'm sure a lot of you are familiar with this. This was an evaluation of health and social services in the Yukon. And one of the recommendations of that report, or one of the findings of that report was that the system was far too focused on treatment and emergency response, and it recommended a reorientation of the health system to make it take a more population focus, and a focus and a reorienting the system so that it actually addresses the social determinants of health as well as this health system responsiveness. What's interesting about this report is not just calling for a need to focus on the social determinants of health, but also it notes some of the unique features of the Yukon that sort of change the lens through which we look at social determinants. And it highlights the fact that there are very different determinants of health that need to be considered for Indigenous communities. And so my project is looking at developing a social determinants of health framework that sort of could inform that reorientation. So it will help with, help government guide decision making, and there's a lot of talk, of course, here about the need to expand the capacity to use data, so it's actually to inform that sort of data infrastructure development as well. A bit more about the rationale for this project and my approach to it. So in terms of the evidence base, so there's a very, very large evidence base supporting the need to focus on the social determinants of health. Social determinants play a far bigger role than treatment, than health systems in our health. That's incontrovertible at this point. And the other important, the other aspect of that evidence base that's growing now is that we know that the inequities in health are a consequence of inequitable access to social determinants of health. So structural determinants. So these are not, it's the unfair and unjust distribution of social determinants, which is very important when we think about how we act on social determinants of health, because there's a tendency, and this is again quite solidly reported in the literature, that a lot of the action on social determinants of health tends to focus on upstream factors, so things that are very easy to deal with, and it tends to avoid changes to structural determinants, so things that are much more difficult to address. So it's important to note when we're talking about social determinants of health that where there is inaction, It's not really a knowledge translation problem, or it doesn't tend to be a knowledge translation problem. It tends to be more about, the difficulties around addressing issues of social justice and, as it says here, countering structures that block action. So there's some aspects to the project that are trying to deal with that in some ways, but it's obviously a very challenging thing to address. And then in terms of the focus on frameworks, so frameworks in any aspect of policy and planning, they're very useful for defining the scope of a problem, narrowing where you can act. And in terms of finding a social determinants of health framework for the Yukon, there are many, many, many social determinants of health frameworks out there, but they really vary in their focus, the kind of theories that underpin them, and their applications. So, and as I said, there's many, many available. So it's about how do we choose one that might be appropriate for the Yukon. And when thinking about how you would choose a framework that you could use in the Yukon, we need to start thinking about adaptation, because there is, in a lot of areas of research, there's this problem of, of research being focused in the South and not taking into account how things are different in northern communities. This is definitely a problem when you look at social determinants of health frameworks. They tend to be very urban focused, and they tend to be very southern focused, and don't consider, not necessarily that the determinants of health are different in circumpolar or northern regions, but how those determinants act on population health may be different. And then there is this other problem, which is that these frameworks don't tend to consider that point I raised earlier before, which is there's a very, very growing literature or a growing recognition that the determinants of health affecting Indigenous communities can be very, very different, or are different. Apology, you don't need to memorize this. There's no test at the end. It's a bit overly complicated, but this is the framework that I'm using. This is based on an implementation model called the Implementation Roadmap. And it's a model that tends to be used in clinical practice. So it's it's essentially a series of steps that allow you to gather evidence, to appraise that evidence, and then contextualize the evidence. So it's really about following those steps in bringing evidence into this case, hopefully into policy-making environments. The first, so it's, for my purposes, the frameworks are the evidence that we're looking at. So it's going into the literature to find social determinants of health frameworks, but then going through these steps of appraising and contextualizing those so that they would fit for the Yukon. And I'm not going to get into the nitty-gritty of all of these steps, but as I said, it's this process of gathering evidence, which is the frameworks. It's appraising those, assessing them for their relevance to the context. So it's gathering evidence about context of here in the Yukon, and then making decisions about the best fits and aspects of those frameworks that would need to be changed or adapted. And just at the bottom here, where the scoping review, the environmental scan, quality, these are the different sub-studies of the overall project, which I'll describe in a bit more detail. So as you may have grasped from that slide, the first step in that implementation roadmap or framework adaptation roadmap is striking a working group to help identify a problem and the approach to it. So this is the working group that's working with me. So it's Amy Risky, who at the Yukon government, Christine McTavish, who's at CYFN, Dr. Sudnit Radad, who you saw speak this morning, who's the CMOH for Yukon, and then I'm on there as well. I'm not going to go into detail about this. This is a aspect of the project which is sort of more important for my approach to it. And I mentioned early on this problem or this tendency within work or action on the social determinants of health. There's this constant drift away from upstream focus. And so these are kind of, this is a framework that's used to kind of reorient your work so that you're constantly readdressing or moving your focus upstream. So that's the purpose of this. And then there's actually dimensions of this that are built into each of the sub-projects. So if you have questions about that, I'm happy to answer those later. But just in the interest of time, I'm going to move past that. So I said there's three main studies in this project overall. The first is a scoping review of social determinants of health frameworks, which is what I'm in the middle of right now. And the original intention with this was actually going to be a comprehensive scoping review of all social determinants of health frameworks, and that would be sort of the primary external evidence source for this process. But there's way too much literature to actually go through. It's massive. So together with the working group, we came up with two sub-questions, one focused on northern, rural, and remote frameworks, and the other on Indigenous frameworks. So I think the scoping review is probably going to focus on those. And then we'll use some of the other pieces of the project to fill in some of the mainstream frameworks. And then to sort of maintain that focus on health equity and structural determinants, we're using a health equity, I think it's called the Health Equity Support Score, to assess each of the frameworks for how they focus on structural determinants. The second project is going to be an environmental scan. So this is going to be looking at all of the provinces and territories and what social determinants of health frameworks are being used there and how. But then together with the working group, we're actually identifying other areas, like other health systems that are actually parallel or kind of mirror the characteristics of the Yukon. So one that's brought up in the Putting People First report is Alaska. We may also look at like a health authority or region in New Zealand, and we just haven't got to that stage yet. And then the third project is going to be a series of semi-structured interviews with both people within government that outside of health, so other sort of intersectoral other sectors within government that would have an influence on the social determinants of health, and then other organizations, community-based organizations that work in areas that would be relevant to social determinants. And this is to gather contextual evidence about what might be different or unique to the Yukon that would change how you would reflect on, like to give us information that help guide through how we might adapt frameworks that don't reflect the northern rural context. And then the final or the last project in this process is meant to be a deliberative dialogue. So in the standard implementation roadmap, this is a key phase where all of the evidence is gathered together, it gets appraised, and then you converse about how you would adapt it to local context. And this tends to be a stage where you bring, anyone that would be sort of affected by a decision would come to the table and have a say in how that evidence gets adapted. This is, I think, for the purpose of the PhD, it's not clear to me. So I would like to do this, but I think this starts to where you start to move from the position of like a PhD researcher. This is into the realm of the political, let's say. So it's not clear if this is actually achievable within the PhD, but I do think this would be a key stage if that would be necessary to do to complete this kind of process of adapting frameworks. And the original concept was that this would be, interested affected groups within Yukon and First Nations would be at the table to sort of converse, debate these different sources of evidence and how they would eventually lead to adaptation of a chosen framework. But it's not clear how that would be achieved, or if that could be achieved within the confines of the PhD. And then I just wanted to highlight some of the limitations of the project as it's proposed. Like, these aren't the only limitations by any means, but I think these are key ones. So this framework, this framework adaptation roadmap, which is itself a framework, which I think is pretty solid, but it's very difficult to comprehensively gather all the evidence required to maybe fully achieve this process. And one of the pieces that is currently missing from the process as it's been presented here is there's no actual formal mechanism for First Nations input as of yet. So I didn't want to sort of predetermine what that was. That is something that I'd like to try to build into the project, but that's not there yet. And one suggestion from the thesis committee was actually, instead of trying to, because of the political challenges of doing a comprehensive series of dialogues to the extent that would be required, because that would be so far outside the confines of the PhD, one suggestion is to sort of gather or put together a kind of blueprint of how those dialogues could be put together and take place. Yeah, that's it.
Great, thank you very much, Chris. I think that's fantastic timing to leave a space for questions. So if anybody either in the room or online has questions for Chris, just let us know.
Oh, there we go. Hi, Chris. Thanks for that. I'm really interested in the health authority part. Have you dove into that? Like in Alaska, they do the NUCA program, and in BC, they've taken over like the First Nation Health Authority program, which allows them to offer an expansion in the services, an expansion in the medications that they can actually cover, because they partnered up with Blue Cross, so it gives them a bigger range. So would you mind talking about that just a little bit more?
Yeah, I mean, to be honest, it sounds like you know more about that than I do. No, I think the idea, though, is originally the idea was to do an environmental scan of Canada, but now, what all the other provinces and territories are doing. But then in talking to, members of the working group, it's like, well, a lot of Canada is not as relevant as other areas. And then it's about figuring out what are some areas that look a lot like the Yukon in terms of, the mix of population, the kind of rural and remote dimensions that have to be dealt with, the mix of settler and Indigenous communities. So that's why Alaska came up as a good example, and that's why New Zealand came up as an example. Probably there's going to be examples in Australia as well. So it's about trying to look beyond that Canadian frame to see is there something more relevant to the Yukon for that source. But in terms of your question about how those health authorities are being done, but the First Nations Health Authority in BC was one that was brought up as well that we would look at.
Great, fantastic question. We have another question here from Bronwyn.
Thanks, Davida. I'm Bronwyn Hancock. I'm with Yukon I. Thank you for that. It was really interesting. I have a comment and a question, and the comment is that I think the deliberative dialogue blueprint could be really interesting to WISEPOR, thinking about WISEPOR being an entity that can convene, share information, and act in kind of a bit outside of that political space. It might be a nice tool to support some of the conversation that WISEPOR could also continue. And then I'm really interested in the reflexive part of the project, and in the Western science paradigm, as a researcher, you're supposed to remove yourself and be neutral. But in fact, that doesn't take into account a whole person approach. It doesn't I don't think that's a practical or reasonable or appropriate way to enter into a research space. So I'm curious about how you incorporate doing a PhD in a Western institution from that kind of perspective, how you incorporate that reflective practice.
Yeah, I'm happy to talk about that. So again, that reflexive piece, I think I mentioned it, but didn't go into detail, was meant, there is, as I said, there's this recurring problem in this space, which is that every time action is taken on social determinants of health, it tends to always default to really upstream solutions, which is to say things that don't really fundamentally help. So it's, there's this term lifestyle drift where you tend to instead of actually dealing with things like, racism, wealth disparity, I'm not saying those are easy things to deal with. You tend to say, okay, well, let's get people to change, tell people to change how they eat. So that's the kind of difference I'm talking about. And the reflexive component is built in as, that's one reason for it. And I was working with a researcher named Dr. Katrina Plamondon, and she did for municipal governments, she did this guide called Ripples for Change, I think it's called. And it's quite interesting because it actually guides municipal workers, like it's trying to get them to act on health equity and social determinants of health. And it suggests things like, you need to read authors that you don't normally read. So that was like the first step. So you go out, read about people you don't know about. And so that's one of the pieces in the reflexive component, is actually seeking out literature, not only that I wouldn't normally read, but about people that I don't know, but people that live here in the Yukon. So that's one step. And these are just like little things that change your focus, change how you think about things. And then there's a research journal, which is about sort of monitoring how thinking changes through the process. And then there's a couple of frameworks that are being used about health equity. And again, to simplify it a bit, they're just kind of like, slap yourself in the face, essentially, rethink what you're doing, and are you just redoing these same pathways, or rewalking these same pathways of not really dealing with like the upstream issues. So that's the kind of purpose of it, I guess, to explain. And then I really like your idea about WISPOR and the potential role there for deliberative dialogue. I think it's, like I have experience doing research, and so the other components of the project are more in my comfort zone. That's an area where it's a little bit outside my comfort zone, so I haven't yet put those pieces together. So it's, be interested in hear more about that suggestion.
Thank you. Our next presenter might also answer a few of those things too, but I think we have time for one or two more questions for Chris, if anybody has some other questions or comments they would like to share. Nothing online? All right. Well, thank you very much, Chris. I think that sounded very interesting and I think a huge piece. So a big thank you for Chris today.
Thank you.